Thank you. Thank you, Kim. And less of a speaker, more of an award presenter. So excited to just shift in there. We are excited to present our next award for the SIS Awards for 2022. We will be presenting the award for Health and Wellbeing. We are honored to share this with the First Responders First. This is a partnership launched in March of 2022. First Responders First is an initiative of Harvard T.H. Chan School of Public Health, Thrive Global, and the CAA Foundation that takes a whole human approach to addressing the needs of frontline healthcare workers in order to support their ability to serve on the front lines of the COVID-19 pandemic. Here to accept the award and share a little bit more about their incredible work, Deborah Marcus, executive at the CAA Foundation, and Kasia, Laskowski, executive director of Thrive Global Foundation. Please.
Is this, oh, it is on. Thank you so much. And we launched in March of 2020, because if we launched in 2022, that would have been a very busy last couple of months. My name is Deborah Marcus, and as he mentioned, I'm an executive with the CAA Foundation, which is the philanthropic arm of Creative Artists Agency. And Kasia is with the Thrive Global Foundation. And on behalf of Thrive and Ariana Huffington and Dean Michelle Williams from the Harvard School of Public Health and all of my colleagues across the country at CAA, thank you so much for this honor and for recognizing the impact that First Responders First has made, and for giving us this platform to invite you all to participate in the success and the impacts that we also have moving forward. I think there's just an interesting story in what First Responders First is and how it came to be, and I'm going to quickly share with you what that is, and then I'll turn it over to Kasia to sort of share what's next and how to get involved. So in March of 2020, when we all got sent home and we're thinking about where we're getting toilet paper, are we going to get sick, are our family members going to be safe, Ariana Huffington was already in conversations with Dean Michelle Williams, concerned, very concerned, with who was going to care for the caregivers during this time. And CAA entered that conversation on March 14th. And on March 24th of 2020, First Responders First was launched. We launched a fund so that we could raise funds and, as Larry mentioned, take a whole human approach to supporting the frontline healthcare workforce. Initially, that meant, well, hold on, take a step back. So we launched this thing in March 24th to some press releases. CAA engaged some of our clients, Olivia Wilde, friends of the agency, Shonda Rhimes. We started to tell the story in the media. Trevor Noah spoke about it. Mattel joined forces. And then other corporate brands came on board to start funding the work. And what happened, surprisingly, was overnight we raised millions of dollars with no strategic plan, just a desire to do something. So initially, we deployed several $1 million to provide PPE for our frontline healthcare workers, because back in those days, that was the thing. But then we were also keen to keep our ear to the ground. What were the niche needs that weren't being addressed or being given much attention? Childcare. So we partnered with Bright Horizons to provide childcare to nurses and doctors so that they could go to work. We partnered with Marriott Hotels and IHG Resorts to provide accommodations across the country so that doctors and nurses could travel to serve or to keep their families safe from the work that they were doing. And that kind of work, providing for PPE and provisions, continued. In the summer of 2020, we launched our mental health piece of this work. We started putting mental health services and resources and resiliency tools and Thrive microsteps. If you're an Ariana fan, you know what those microsteps are, into the field, because we were hearing the stories of burnout and the stories of distress and trauma and suicide in the profession. But these resources weren't being used. And that was surprising to us people who had really no business being in the healthcare space. But what we quickly learned was that, A, there was a pandemic that was still going on, So that was a barrier for people stopping to take care of themselves. But there are these systemic barriers that prevent clinicians from seeking help, whether it's stigma, whether it's fear of losing their license or fear of losing their credentials, or whether just the sort of the cultural barriers within the hospital that prevent people from seeking help. Those were the things that we needed to address. We didn't need to tell the health workers that they needed to be more resilient and to take better care of themselves. We needed to work with the systems and put the pressure there. So then the third phase of our work began. We partnered with the Dr. Lorna Breen Heroes Foundation. Dr. Lorna Breen was an emergency room physician in New York City who died by suicide in April of 2020 after contracting COVID herself, returning to work because she feared losing her license if she stayed home and got the mental health services that she needed. We partnered with them to put pressure on legislation, and then we launched a campaign called All In Wellbeing First for Healthcare, where we invited the AMA, who was just mentioned, the American Hospital Association, the American Nurses Federation, and the other leading healthcare organizations to come together to join us because together we can be much more powerful than alone. So I'm going to turn it over to Kasia to tell you a little bit more about All In and how you might be inspired to participate.
Thank you so much, Deborah. So in terms of how you can all join us in our work, we would love for you to join us in our efforts to prioritize healthcare workforce well-being. The truth is that as we've seen during the pandemic and beyond, we cannot ensure healthy communities without healthy healthcare workers. There's a direct correlation between patient outcomes and prioritizing clinician well-being. And I think the sooner that we all learn that as patients, the sooner that we all learn that as members of the community, the better. So we would love for you to join us in our efforts. You can go to All In for Wellbeing, All In for Healthcare, apologies, allinforhealthcare.org to join us in our work. Our main two goals with All In for Healthcare right now is one, to advance solutions that actually prioritize healthcare workforce well-being, and those are evidence-based solutions, what is actually working in this space. And number two, we're working to eliminate the barriers that exist to preventing healthcare workers from accessing those mental health services. So we would love for you all to join us, and you can also follow along at our work on #FirstRespondersFirst. But we're just so very honored by this award, and we thank you all for your participation and listening. Thank you.